with my Iowa constituent. Last year, 29 Iowa pharmacies closed, many of which were in rural areas and have served their communities for decades. You own a small group of rural pharmacies and recently had to close some. What legislation would you like to see Congress pass to help rural pharmacists like yourself and the patients you serve? And since bureaucracy can work faster than Congress, is there anything that HHS can be doing that would help along this line?
Senator Grassley, I appreciate the question. Before answering your question, I do have a couple of points. One is I want to be clear that pharmacy deserts occur not only in rural areas but also urban areas, negatively affecting the care of our most vulnerable patients. The second point is that community pharmacy is much more than just a place where prescriptions are filled. It's a place where patients have access to a trusted healthcare partner. It's a place where patients receive healthcare services ranging from medication management, point-of-care testing and immunizations to health promotion and chronic disease management. It's a place where care coordination and medication management service help patients achieve optimal outcomes. And it's a place where pharmacists and their staff work closely and collaboratively with physicians, other providers, and community-based organizations to optimize patient care. To answer the question, as far as the first part of your question and legislation, I think a good place to start is your bill S-526, the PBM Transparency Act, where it bans PBM deceptive and unfair pricing schemes, prohibits PBM clawbacks of payments that have been made to pharmacies, and improves transparency about spread pricing and pharmacy fees. Next, I'd like to address the fair reimbursement to community pharmacies and Medicare Part D. Senate Bill 5, or S-882, the Patients Before Middlemen Act, and enhances the PBM transparency and accountability to reduce prescription costs for seniors. Also ensures all treatments are fair treatment for all pharmacies as it relates to Medicare Part D contracts. But what's missing is, again, addressing reasonable and relevant Part D reimbursement from CMS to make pharmacies whole. Lastly, I talked about the services that we provide beyond prescription dispensing. I do think we have to develop some kind of a payment model for those services that is having impact not only on patient clinical outcomes, but also on total cost of care. Your second part of your question is about HHS and what they could do. And is it possible to provide authority for the Secretary of HHS to fix Medicare Part D payments for community pharmacies to ensure fair and reasonable reimbursement so we can continue to provide care to our senior patients?
Thank you. Ms. Faust, my PBM Transparency Act will require PBMs to be fully transparent about how much money they make and prove their value. What kind of transparency does Navitas provide to its clients, and what does real transparency look like?
Thank you. Navitas provides full transparency. We provide access to all the data, all the clients' data, and access to what pharmacies are paid and auditability of that as a fiduciary representative for our plan sponsors. I think your bill does a great job of introducing transparency, and that's really, really needed in this industry.
Okay. Next, I have a question for Professor Sode. The primary responsibility of a fiduciary is to run a health plan solely in the interest of participants and beneficiaries for the exclusive purpose of providing benefits. At least 5 states have imposed fiduciary or duty of care requirements on PBMs. I think you said this in your statement. Do you want to expand on what you said in your statement about fiduciary responsibilities?
Sure. Thank you for the question, Senator Grassley. I think the price transparency bill that you have proposed complements fiduciary responsibility. So the idea of price transparency is to figure out if you're getting good value for your money or not, if your PBM is acting in the interest of your members or not. And what fiduciary responsibility does is it legally obligates the PBM to act in the interest of the members. So if you find out that the PBM is not acting in the interest of your members, you have some recourse to address that issue. So I think fiduciary responsibility combined with transparency can really make the markets work better for the American patient.
Okay.